Hello, and welcome to Advanced Rehabilitation Services. My name is Maria Duran, and I am a board-certified occupational therapist. Today we're going to be talking about the things a physician should know about lymphedema. The first thing is lymphedema should be diagnosed early. Often lymphedema is caught or diagnosed in the later stages, like stage 2 and on. And this is a problem because what happens is when it's diagnosed later, the chances of reducing the affected body part, it's going to be more arduous. It's going to require longer treatment, and the results may not be as aesthetically pleasing as a client may like. Second, lymphedema may present as a chronic swelling. This is very important to know because if you notice that your affected body part could be your arm, your hand, your elbow, your knee, your foot, are swelling and then they reduce. And it goes like that for a period of time. And then they swell up again and then reduce again. That might be an indication that lymphedema is trying to push in. And you should get that addressed quickly. In order for you to prevent any swelling from staggering and causing the affected area or areas to become disfigured if not addressed timely. Third, lymphedema should be discussed with your physician or healthcare provider as an outcome that may occur post-surgically, depending on the type of surgery you're going to have. And this may require education before the surgery happens. This is a recommendation in order to prevent different issues from occurring, such as the swelling, as mentioned before. Unfortunately, the swelling leads to other problems, such as cellulitis, which is an infection of the skin. It may lead to disfigurement. It may lead to skin conditions, such as hyperkeratosis, hemosiderin staining, papillomas, fungal infections, and many more issues that can cause somebody to end up in a hospital. Therefore, an education discussion on the matter should take place prior to a surgery that will affect the lymphatic system. Fourth, lymphedema can have a physiological and psychological effect on somebody who has it. The physiological effect is the fact that it can have an impact in somebody's body image. And this can be caused by the swelling getting out of control and causing the affected area or body part to be bigger, larger than the non-affected areas. Also, wearing compression garments may be a bit of a discomfort zone for some clients. They feel awkward socially, and that may cause an impact on their social life. In terms of the psychological effects, the clients do not feel comfortable being in public, being seen by others, whether they have a large extremity or affected part, as well as wearing compressions. They may decide to be isolated, decrease their interaction with others, or limit themselves to only certain activities, leaving behind other ones that they may have enjoyed in the past. Fifth, lymphedema clients may feel that they are part of an invisible population. And this happens because many physicians or healthcare providers do not recognize the issue on time. This causes a lot of patients or clients to feel in despair. Many of my clients have gone from one healthcare provider to another, sometimes seeing 3 or 4 healthcare providers prior to being diagnosed. And for them is physically and mentally exhausting, as well as financial. Sixth, lymphedema clients may require to be referred to mental health providers. The reason is that because of this condition affecting their social and psychological well-being, they may fall into a state of depression, anxiety, fear for the future. Therefore, help with their mental hygiene might be necessary. Seventh, lymphedema may be exhausting and debilitating because a client may be carrying a body part that is heavier, larger. These may hinder their ability to participate in activities that they may have liked before, such as sports, hiking, running, swimming, and they may feel depressed, and this can cause for them to have a mental exhaustion as well as a physical exhaustion because they feel powerless. And they may decide that maybe an activity is going to make it worse because they're not informed of the benefits of exercising and actually moving to help that area improve lymphatic flow as well as vascular flow. They may not be aware that there is lymphedema therapy for the treatment to address the issues that they have so that they can go back to doing the activities they like. And this is important for a physician to know, or a healthcare provider to know, that these clients can and should be referred on time for therapy through a certified lymphedema therapist to take care of these issues timely and allow the client to go back to their regular routine as quickly and safely as possible. Eighth, lymphedema decreases quality of life. So when somebody has lymphedema, first of all, besides not feeling happy with their image, they have more difficulty fitting into their clothes. They have difficulty moving in trying to perform their daily activities, as well as their home care management, childcare, work-related activities. So their quality of life and performance significantly is reduced, and this can cause an impact in their finances or their ability to care for others, especially their primary caretakers, such as a mother or a caretaker for a family member. Therefore, it's very important to address the lymphedema timely for these clients, for these individuals to be able to be functional and productive members of society. Ninth, lymphedema therapy can be costly, can be complex, and lengthy. So when lymphedema is not diagnosed timely, like I mentioned before, if you're stage 2 and higher, what happens is the time that a client will spend with therapy, it's going to be longer in order for the body part to be managed and reduced. If the insurance does not pay for supplies or compressions, that becomes another burden financially to a client. Therefore, it can affect their ability to provide for their family or for the client to be able to purchase the needed supplies for the management of the lymphedema. This is very important to note because when lymphedema is diagnosed timely, stage 1, stage 0, then a garment that could be over the counter can be purchased. And usually they are much less expensive. And depending on the area that you are, they may run between $50 to $100 to $120 compared to a custom garment that can run, depending again on the area that you might be located, between $120 and up. And these can be very difficult for somebody who lives on a fixed income. Also, the complexity of the treatment, like I mentioned before, it requires layers of compression for the swelling to be put under control. A lot of clients do not like that, and the level of compliance can also decrease dramatically when somebody is not comfortable having so many layers of compression bandaging, causing the therapy to be much more lengthy as well as more costly, especially if there is a co-payment, co-insurance involved. Therefore, it's very important to address the lymphedema on a timely manner, or speak to your clients about the possibility of happening so that a client is more aware and can bring any issues that do not feel right to the physician for it to be addressed quicker. 10th, lymphedema is different for each individual. Through the years of experience treating lymphedema or clients with lymphedema, they're having different signs and symptoms for each individual, although some of them do overlap. But some people may experience pain, discomfort, swelling that comes and goes, swelling that does not go away. Some describe it as a joint pain, heaviness. Some may not even have any of these symptoms and all of a sudden just have cellulitis, which, as I mentioned before, is an infection of the skin. Some of them may say, oh, my jewelry does not fit anymore. Some of them have gotten stuck with the jewelry in their fingers to the point that they have to go to a locksmith to get it cut, or they have to go to a jeweler to get them resized because they don't fit anymore. So I think it's very important for healthcare providers to listen very carefully to the clients who are describing the symptoms. I do understand that many doctors do send their clients for further testing, and that's all valid because a doctor would like to rule out other conditions such as blood clots. And once a client is cleared that there are no blood clots, a client can be safely referred to a lymphedema therapist to get an evaluation and start the treatment right away. This in the long term is going to save money, time, and lots of hospitalizations. As mentioned before, these conditions can lead to some nasty skin problems and health problems that lead people to go into the hospital, not for one day, but for many days and sometimes months, because the issue has not been addressed timely and it's a big headache. So very important to communicate with your physician about your symptoms. Make it clear that this is something you're feeling, because many times these are symptoms that are not seen. Take pictures. Compare yourself to your non-affected side. Ask family to take a video or take a video yourself, and take all this information, bring it to your physician for him or her to see what has happened at the moment that you saw these occur, because by the time you go to your doctor, the issue may have resolved, especially if you're in the early stages of lymphedema. If you found this video helpful and informative, please like and subscribe and share with others. If you have any questions, feel free to contact me via phone, text, or email. I look forward to working with you on your path to better health.